and gentlemen, on behalf of Pacific One Health, Heal Foundation and the India Habitat Center, it gives me immense pleasure to welcome you all to Heal One Health Connect series. We are delighted to have such a distinguished gathering of healthcare leaders, clinicians, academicians, and change makers with us this evening. Your presence truly reflects our shared commitment to reimagining healthcare with compassion, trust, patient centricity at its core. Today's theme, Patient Care as It Should Be, is not just a statement. It is a reminder that healthcare is ultimately about people, dignity, empathy, and outcomes that matter to patients and their families. Before we proceed, I would like to acknowledge and thank the Pacific One Health team, whose vision of micro-hospitals is redefining accessible high-quality care. The Heal Health Connect team for its continued efforts in advancing humane and ethical healthcare. The India Habitat Center for graciously hosting us this evening. A special word of appreciation to all members of Heal Foundation, Pacific One Health team present here today. Your dedication behind the scenes make platforms like this possible. It is now my privilege to invite our welcome address speaker, Dr. Swadeep Srivastava, co-founder and president, Pacific One Health, New Delhi. Dr. Srivastava is a passionate advocate of patient-first healthcare and has been instrumental in shaping the micro-hospital model in India. May I request Dr. Swadeep Srivastava to kindly take the stage.
Thank you, Vigya, and thank you everyone, all the distinguished guests today, all the eminent panelists. It is my privilege to welcome you all for this evening on this unique subject of patient care as it should be. So, patient care is central to the healthcare evolution in India. Today, we thought to step back and look at this subject of patient care, which everybody feels now is getting lost in the whole maze of corporatization of healthcare. That's why I thought it is very important, very pertinent to sit back on and discuss on this topic. What are the gaps? What are the challenges? What are the difficulties our patient and caregivers community are facing? What is the status of doctor-patient relationship? Why the trust deficit is happening so fast in doctor-patient and hospital-patient relationship, and so many other issues related to patient care, and how we can bring back healthcare, how we can bring back patient centricity to the core of healthcare. With this objective, what we are building at Pacific One Health and what we are trying to do with respect to bringing patient centricity at the core of healthcare, we also wanted to highlight that aspect, and we thought what a better way of doing it is through knowledge-oriented discussions and deliberations from the experts who deal with patients on a day-to-day basis, their perspective. At Pacific One Health, we have taken a motto of healthcare as it should be, and so today we are trying to find out one aspect of it, that is patient care as it should be. What is that it should be? So with this objective, on behalf of Pacific One Health and on behalf of Heal Foundation, and most importantly on behalf of India Habitat Center, who are our partners for this movement in healthcare education, we are doing a series of One Health Connect series with India Habitat Center. Hosting this series, we have committed one such deliberation, talk, discussion, one such program every month, which will keep growing over a period of time. We are organizing a large conference with India Habitat Center on 7th of March. It's a full day conference that is again on patient care, patient related issues, and it is called CareCon 2026. So of course that is one bigger program which will be emerging after this smaller talk series which we do on a regular basis. And we are committed to take health education, patient education, and the overall patient empowerment to the next level through these talks, deliberations, and taking the learnings from here and taking it forward in the form of our own healthcare ecosystem, which we are creating in the form of Pacific One Health. We are coming up with 4 hospitals from March 2026 in Delhi NCR, going up to we call these micro hospitals, small 50-bedded small micro hospitals, but very well equipped multi-specialty hospital. A lot of top experts and doctors and big key opinion leaders, doctors also joining us in this program, and that's what we want to create, the difference on ground in the healthcare delivery, starting from Delhi NCR and then going across the country in next 5 to 7 years. With this, again, I welcome you all, and we can start with the first panel discussion.
So we now officially will be starting our first session, which is on the Trust Reset, Humanizing Care in Corporate Hospitals. This session focuses on rebuilding trust by placing empathy, ethics, and human connection back at the heart of corporate healthcare. To guide this important discussion, we have with us an esteemed moderator, Mr. Rajiv Tikoo, senior journalist and former editor, Outlook Group, with decades of experience in health journalism. Mr. Tikoo brings a balanced and insightful perspective to this conversation. Joining him on the panel are Dr. Saumya Ahuja, Head Medical Services, Pacific One Health, New Delhi; Dr. Rajeev Nangia, Head and Neck Surgery Expert, one of the renowned head and neck surgery experts; Dr. Manish Sinha, he is one of the renowned neurology experts; Dr. Prashant Jain, urology and laparoscopic surgery expert. Each of our panelists brings unique clinical and leadership insights into how trust and compassion can be restored in modern healthcare systems. I now invite the moderator and the panelists to kindly take their places.
Thank you, Vikya. I'm delighted to be part of this inaugural episode of the series, which promises to be quite different from what generally happens in these sessions. Thank you very much for this opportunity. So I'll begin with Dr. Saumya Ahuja, who's Head Medical Services, Pacific One Health, which are behind this exercise actually here. From your experience of managing integrated care services, what are the most common healthcare issues that really bother patients, and when they become serious, how to preempt that kind of a situation? So, Dr. Saumya.
So, good evening, everyone. So, Mr. Rajiv, the thing is that from the last 30 years of experience in the landscape of healthcare, so we come to know that the complex cases are not the issues. Mm-hmm. The issues are silent issues, where the people do not take care of the things such as your breathlessness, shortness of breath, chest discomfort. So they take it as a very easily. So they land in the hospital when they are in the advanced stages. So that time they say just till yesterday everything was fine. So I'll urge my fellow colleagues in the panels that they should stress more upon coming from the reactive stages to the pre-active stages. That the patient should be told that they should get their preventive health checkups done. Because as it happens in the other the EU countries or the European countries, that the people are told to they should have a regularly health checkups. Because when we are taking our own cars and everything for the preventive checkups, then why not our own body? We should be more active in that. And then only they can be do the needful and they can enjoy their life. They can live their life health as it should be.
Right. Dr. Rajeev Nangia, who's ENT and head and neck surgery expert with us. Now, this is a very rare combination which we don't come across. We normally come across what we know as ENT generally. I'm sure it goes together actually. ENT problems generally dismissed as very trivial. We don't take them very seriously. Now, how do we really identify these harmless symptoms and address them before they become serious?
Yeah, good evening, friends. First of all, our motto of Pacific One Health is to give a human touch and be a good listener, so that we listen to the patient and their relatives, get to know the problems, give them some time so that they also feel as a home environment, and then try to diagnose the problem as soon as possible and treat them, basically nipping the problem in the budding stage. Now, coming to my field, which is the ear, nose and throat. In the ear, the normal symptoms are like hearing problems, decreased hearing, Then tinnitus, that is the ringing sensation, which is a very common problem. Then the balance disorders, the vertigo, the rotatory sensation. In the ear, the hearing can be divided into two sections, you can say. The problem with the younger children, like 3 to 12 years, and then hearing in the adults. So in the younger generation, what happens, it is attributed to just a simple wax, or the patient say that he is not attentive, or he is not listening, he is not concentrating in the class or something. So if it is a wax, that's a very small trivial problem that can be taken care easily. But in certain cases, there is a condition known as secretory otitis media, that is the glue ear. What happens is the collection of the fluid behind the drum, which goes on becoming so thick that it becomes like a glue, and the drum gets plastered on the ossicle in the inner ear, which can be cause for permanent deafness and clostrotoma, which are bad diseases. But a very simple surgery like myringotomy with ventilation tube can prevent this. And the main cause is to diagnose early with PTA, impedance, and examination of microscope and take care of that. Now coming to the hearing problem in the adult group, what happens, that is attributed to normally aging and senile dementia and other things, and that can be taken care with hearing aid and other things. But in case it is accompanied with tinnitus, balance disorder, and some facial numbness, then that can be precursor of tumors of the 8th nerve and the brain tumor. So again, the aim is to diagnose early and treat early. Coming to the second part of that's the nose. In the nose, there are the harmless symptoms which we say is running nose, sneezing, bleeding nose, or a blockage nose. Now coming to the symptom like running and sneezing, they can be simple things like allergic rhinitis, and that can be taken care of with medical treatment only. In case of blockage, there are certain things like we call a deviated nasal septum, again can be taken care with a very simple surgery known as septoplasty. But certain cases can be there, the blockage can be due to polyposis or some tumors which can be either benign or malignant. And polyposis, if diagnosed early, again with a simple test like CT scans or CBCT and diagnostic nasal endoscopy, then these polyposis can also be taken care in a very early stages without doing surgery. So the motto is like prevention is better than cure, right? And now coming to the last part, that is the throat. The common symptoms are the change of voice or hoarseness and throat irritation, and then a problem in swallowing. When we talk about this change of voice, it is normally seen in people who have voice abuse, like politicians, teachers, singers. So there's a condition known as vocal nodules. Again, if detected early, we may not need surgery, but if it goes in the higher stage, then we have to go for the MLS, that's the microlaryngeal surgery. And lastly, talking about the throat irritation, daily AQI, so everybody has got something or the other, so that is a different issue. But if this difficulty in swallowing, if associated, this is also related sometimes with the esophageal reflux, that is again a small problem, but sometimes it is a precursor of laryngeal and esophageal cancer. So the takeaway message is prevention is better than cure, diagnose early and treat early.
Thanks a lot for that detailed kind of answer, and I think hopefully we'll have some answers there. I'll welcome Dr. Prashant Jain here, who's a well-known neurologist and endocrinologist. While as we talked about awareness issues generally, but when it comes to men's health and reproductive health issues, there's still taboo surrounding those issues. And here, what are the early kind of symptoms that can be picked up and that need to be addressed before they become long-term complications, sir?
This question is by and large focused right now. Right now it is focused to men's health. But in general, if you see every disease, if you treat it early and then get a cure, that is the best possible, expectations a person has, and we also wish for that. If we talk about men's health or men and female, male and female both, if you call that sexual health of a person, then definitely there are few specific corners which have to be addressed, because still it is associated with taboo, like people hesitate to discuss. Also the problem of getting the right treatment, because few problems which can take a very big shape or become very complex over the time are taken very lightly in the beginning, especially if I talk about, you asked about male health, but I am talking about female health in urinary system, that is called as UTI. If you see urinary tract infection, our females, our sisters and mothers, and every lady takes it very lightly most of the times, like ye to common hai, ho jata hai, and they take some over the counter tablet and try to get it treated but not cured, and that takes a big shift. Coming back to men's health, especially related to a few diseases which are specific to male, like prostate related problems, prostatitis, or BPH, benign prostatic hyperplasia, which is a later part of the age which comes up, and malignancy. These things are to be diagnosed early in life whenever it is presenting. Why? Because this is something which is everyday life. Like voiding is an act which is 6 times or 7 times in a day. More than that or less than that, and having difficulty in doing that may cause problem if you linger on, like I'm getting late to the office, I'm busy, so I'm not going to the doctor. Asking someone, taking some medication for that over the counter, which creates a bigger problem. And missing cancer prostate is one thing which is very, very serious. Why? Because we don't go to the specific specialist or super specialist, in which condition India is like a heaven. Here you get a urologist or any super specialist within minutes, at 11th hour also. In Western countries, if you see, it is very difficult to get a specialist opinion even. So although for more than 70-80% of the people here in our country population, the first line of defense and approachability is to GP only, but here you can immediately go and without any legal or any other restrictions to a super specialist. Still people have restrictions and other things, so that they don't get the right advice from the super specialist.
Right. I'll come back to Dr. Saumya. You talked about awareness, you talked about not taking things seriously. Now, the challenge we have now is, the first thing is that we do our home treatment, our home remedies. The second is that all of us are doctors in our own way. And thirdly, now ChatGPT is also there. So what kind of caution would you advise to people here?
So that's a very interesting question which you have asked. That is the burning issue right now. So I'll suggest everyone, not to take the health of the Google Babas and all. So they should consult the doctors rather than going to all the AI chat GPTs.
Why does one take the decision really that I really need a doctor actually?
So thing is, which as I've already told you, that small signs which are known as the silent issues, that should be not taken them very, very lightly. They should be consulted with a consent, at least with a GP you should talk. Then only you can go to the super specialist. At least you take an initiative. Step has to be taken. You have to go to the consulted doctor. Then only come to know what the problem actually is. Then only you can take some action on that.
Dr. Nangia, you referred to AQI. Now, even if we go to a doctor as of now in Delhi or any other place, and they still say that it's because of pollution, there's not much we can do. Okay, we can have some medicine. So, how does it really handle? Now, pollution is going to be with us for many years, unfortunately. It's not going to go away overnight. So how do we really address this issue?
Until March, I think it will be there.
Not only, it's going to be, it has been there for the last 10 years.
Till March it will be this high, then
maybe
it
lesser.
will go down a little bit.
So what will be the long-term kind of approach to pollution issues, air pollution? Let's look at this.
See, the first thing is to avoid exposure. That is a difficult thing. But whatever exposure you can avoid, that is the number one. Second is to maintain your immunity, and sometimes you can have this herbal things and Chavanprash and all those things like Amla, and these are the natural immunity things. Then come the third part, the immunoboosters which we have in the allopathic medicines. That again can do the things. And finally, the thing is, if you are suffering from any other problem, especially in my field, and if you are having some deviation septum or something, that has to be diagnosed early and taken care of. Because I have seen patients who have not breathed from one side, the older patients, but they have had a very good life. But now the people who are in 20s and 30s, we recommend them surgeries because they need more oxygen. So that is the only thing we can do, and the pollution has to be taken care by the government.
Dr. Prashant, we still see that more females do go to gynecologists, for example, and lesser men. Maybe there are lesser urologists, I don't know that. But we see there's a bit of a more gender awareness here. Is it because of circumstances, because of gender issues, or because there are more issues? Maybe UTI is one exception probably. But overall, we see that females are more amenable to going to a doctor than men in these kind of issues. What is the reason here?
We compare most of the things of our society with the Western society. But we have to understand that ours is I won't call it a conservative society, but there are different, limitations and boundaries which we follow than the other, Western countries they follow. Here, and awareness is a big problem, especially the health education, health awareness. Considering these few things, because they don't know where to go in the first instance. Second, the availability, as you said, rightly said, that there is a very, very irregular or disproportionate distribution of healthcare system in our country. If you see in Northeast, if you see, hardly any specialist is there in whole city. Yesterday I was talking to one cardiologist. He is a junior, joined in Delhi somewhere. He came to my hospital also, and I asked him, why are you not? He is from Tripura. He said, there is no cardiologist, and they are asking for us to join, but I wish to settle in Delhi. So these things, the people there, they are not, especially coming to the female point, they are more comfortable, that is right. Second, gynecologist is the only specialty I remember which is gender specific. So they most of the times, other than the infertility specialists, they deal only with the female. So they feel, obviously, naturally they feel more connected and more open to them. Their duty at the gynecologist level is to segregate which is their area and which is to how to convince, how to guide them, and then they go to the specific either male or female sector, which now is growing. I have seen this is one segment where I would say that this GPT, Chat GPT, and all that, Google, is a bit helping, because otherwise it's one-way traffic and it is definitely going to hit wrong ways. But it guides them to go to the specialist, even if it is a male or female disorder.
Just one quick question for all of you, sir. Lots of us want to go through teleconsultation route before we go to a doctor. So what are checks and balances here we should observe, which will be useful?
So regarding checks and balances for the teleconsultation, I mean, first of all, you should see with whom you are taking a consultation. Whether it is up to that, for example, for a urology, you should not talk to a cardiologist. So that is the main thing, I mean, you should be aware of. With whom you are having a teleconsultation. Whether it is up to the mark or not.
Dr. Nangia, for you?
Basically, we can just give him a brief idea what he's suffering. We can't say, because like ENT, I cannot say anything. For my field, if I don't see the things, I cannot say anything. I can just give him a certain advice that he can do. Otherwise, I cannot treat him properly.
Dr. Jain, lots of people would prefer anonymity of teleconsultation rather than going to an urologist, probably still in our society. So what would be your advice to such people?
See, I would say that is at their own health risk, because examination is a very important, history taking and examination is a very important part of any treatment which leads to cure. If someone wants just temporary, like someone is sitting in USA and coming next week, there it is, healthcare availability is risky and costly that way. For time being, you can do a teleconsultation. With first opportunity, you should go and see to the specialist, because examination is one thing and thorough examination and history taking is not possible. Examination is impossible. Other than skin disease or something like that, they can answer, and very well that can be taken care of. But that way, the treatment is delayed and inappropriate, I would say. At least cure is difficult.
Right. Thank you very much. And what comes out is actually prevention is better than cure. Seek advice as early as possible and seek from the right sources.